ReShape's unique dual balloons are inserted by a highly trained physician in an outpatient medical setting. The procedure lasts about 20 minutes. During the procedure, the patient is comfortably sedated under light anesthesia. An endoscope is used to insert the balloons through the mouth, down the throat, and into the stomach. Sterilized salt water, called saline, is used to inflate the balloons. Once the balloons are inflated, the endoscope is removed and the insertion procedure is complete. The balloons remain in the stomach for 6 months. After 6 months, the balloons are deflated and removed during a similar endoscopic procedure. Both the insertion and removal procedures are non-surgical, require no incisions or permanent changes to the digestive system, and may be completed in an outpatient environment.